I'm a barista in Melbourne. Been pulling shots for 7 years. Last month, this American tourist walks in during our morning rush, orders a flat white, and I hand it to him after 3 minutes. He stares at me like I've committed a federal crime. 3 minutes. In New York, I'd have this in 90 seconds. Don't you understand I have emails? I wipe down the steam wand. Mate, your emails aren't going anywhere. Stands there, gripping his cup, genuinely distressed about a 2-minute difference. But productivity metrics show every minute costs businesses $17 in lost revenue. I read a Harvard study about it. I tell him the coffee's ready. He should probably drink it. He doesn't move, still calculating his theoretical losses. My cousin manages a pharmacy in Perth, and she had an American tourist burst through the door, demanding immediate antibiotics for what he called his emergency sinus situation. She asks if he's seen a doctor. He explains that back home in Chicago, can't just get antibiotics without a prescription because the medical system is designed to maximize pharmaceutical profits. But he assumed Australia would be more chill about such things. She points out we also require prescriptions. He launches into a 15-minute explanation about how the global healthcare conspiracy extends further than he thought, and he needs medicine now before his condition deteriorates into full respiratory collapse. She asks when his symptoms started. This morning, he says. She recommends rest and fluids. He asks if she understands the mortality statistics for untreated sinus infections, citing numbers that sound completely fabricated. I work at a hotel reception desk in Sydney, and last week an American couple checked in and immediately asked about our bushfire evacuation protocol. I explain we're in the CBD, surrounded by concrete and harbor, approximately zero bushfire risk. The wife interrupts to inform me that climate scientists predict increasing fire danger in all Australian regions, and their travel insurance specifically covers bushfire evacuations. So, clearly the risk is significant enough for international insurance companies to acknowledge it. I mention we're literally on the waterfront. The husband pulls out his phone to show me a map of Australia's fire zones from 2019, half of which is colored red. See, significant risk. Point out the map is 6 years old and refers to rural areas 300 kilometers away. He says they'd feel more comfortable reviewing our emergency procedures anyway. I give them the fire exit map. They study it like it's a tactical operation, taking photos and marking potential secondary routes in case the primary route is compromised. These aren't isolated incidents. Every summer, Australia gets an influx of American visitors who arrive expecting Mad Max, but find coffee culture and beaches. And every summer, I watch them transform routine situations into federal emergencies. The pattern repeats itself across every cafe, pharmacy, and hotel lobby. Americans don't just visit Australia, they stress test it. My brother-in-law teaches surfing on the Gold Coast, and he once had an American student who wouldn't enter the water until they'd reviewed the complete shark attack protocol. He explains there isn't a formal protocol because attacks are exceptionally rare. You're statistically more likely to die driving to the beach. The American produces a laminated card from his wetsuit pocket listing 17 steps for shark encounters, including maintain eye contact and strike the snout with force. My brother-in-law asks where he got the card. I made it based on aggregated data from marine biology forums and survivor testimonies. He's annotated it with highlighter and written additional notes in the margins about great white behavioral patterns. My brother-in-law paddles out. The American stays on shore for 20 minutes, conducting what he calls preliminary threat assessment observation. When he finally joins us, he keeps spinning around, checking every direction, asking if that shadow was a shark. It's a dolphin. I'm a physiotherapist in Brisbane, and an American patient came in reporting lower back pain from sitting at his temporary desk. Standard case? I show him some stretches and suggest he adjusts his chair height. He interrupts to ask about the recommended lumbar support angle and whether Australian workplace safety standards align with American ergonomic guidelines. I mention we have our own standards. He pulls out a tape measure and starts measuring his current setup, explaining that in America, OSHA requires specific measurements to prevent long-term spinal compression injuries, and he's concerned that Australia's more relaxed approach might lead to permanent damage. I watch him measure his keyboard distance to the millimeter. What's the Australian standard for monitor height? I tell him roughly. I level. Roughly. He looks horrified. In the States, we have precise specifications for this. We don't do roughly with spinal health. I suggest he might be overthinking it. He says that's what everyone tells him before they end up with chronic pain and disability, claims my wife works at a library in Canberra. And last year, an American researcher spent 45 minutes arguing with her about our late fee system. We charge $2 per day, maximum capped at $20. He insists this is economically inefficient because it doesn't scale with the item's replacement cost and creates perverse incentives for patrons to keep valuable books. My wife points out the system works fine, but what if someone keeps a rare book for 6 months? She explains we'd contact them long before that. He launches into a detailed analysis of how American libraries use percentage-based fee structures tied to item value, preventing exactly this type of systemic exploitation. Have people been exploiting the system here? She asks. Well, no, but theoretically they could, and that's a policy failure. He diagrams his proposed replacement system on a napkin, including formulas for calculating optimal deterrent fees. My wife tells him his books are due back in 3 weeks. He asks if she's going to implement any of his suggestions. She says no. He leaves the napkin on the counter anyway, just in case. I'm a tour guide in Tasmania, and I once had an American couple who wanted written confirmation that our walking track was legally certified safe. I explain it's a standard bushwalk. Maintained by Parks Service, thousands of people do it annually. The husband asks who's liable if they're injured. Well, if you're negligent, you are. He looks stunned. What about the park's duty of care? In America, we have clear liability frameworks that protect visitors from hazardous conditions. I mention we expect people to take reasonable care of themselves. His wife asks if we've conducted recent geological surveys to ensure no unstable ground. I tell them the track's been here for 30 years. 30 years without updated safety assessments. He starts Googling Australian personal injury law on his phone. His wife suggests maybe they should skip this walk and find something with better safety documentation. I mention the track has safety signs at the start. They spend 15 minutes reading every sign, photographing them, and discussing whether they constitute adequate warning. When they finally start walking, they turn back after 10 minutes because the husband decides the liability. Ambiguity is too stressful. I'm a waiter at a cafe in Adelaide. And last summer, an American family sat down and immediately asked for our allergy protocol documentation. I bring them menus. The mother explains her daughter has a mild tree nut sensitivity, not anaphylactic, just some itching. And in America, they have standardized allergy information for every menu item with separate preparation protocols. I tell her I'll check with the kitchen about specific dishes. Just checking? Don't you have written procedures? I explain our chef knows what's in everything and prepares food carefully. She looks at her husband. They don't have procedures. The father asks how they guarantee zero cross-contamination. I mention we're a small cafe. The chef's been cooking for 20 years. He's very careful. The mother pulls out her phone to show me photographs of American restaurant allergy binders. Thick documents with preparation, flowcharts, and ingredient sourcing information. This is the standard we're used to. Can you match this level of documentation? I tell them, our chef can accommodate allergies, but we don't have a binder. They order salads. Watching the kitchen nervously through the service window, the entire meal. My dad owns a butcher shop in Newcastle, and an American tourist came in asking about our USDA equivalency certification. Dad explains we have Australian standards, different system but equally rigorous. The American wants to know the specific antibiotic usage rates in Australian beef. Because in the States, there's ongoing debate about agricultural pharmaceutical practices. And he's trying to make informed protein choices. Dad tells him the meat's good quality, locally sourced. Locally sourced doesn't tell me about antibiotic residue levels. The American proceeds to lecture my dad about American grass-fed versus grain-fed standards, omega-3 ratios, and the superior mineral content of American beef due to soil composition differences. My dad's been a butcher for 35 years. Mate, do you want a steak or not? The American asks if we have any literature about our sourcing practices. Dad points to a sign saying local farms. The American photographs it, seemingly unconvinced this constitutes adequate disclosure. He buys nothing and leaves a business card for a grass-fed beef certification organization in case we want to upgrade our standards. I'm a bartender in Hobart. An American patron once refused his beer because I didn't check his ID. He's clearly over 40, graying at the temples, visible crow's feet. I tell him he's obviously legal. But how do you know? In Boston, every establishment checks every customer regardless of apparent age. It's about systematic compliance, not assumptions. He continues explaining that America's strict carding policy eliminates subjective judgment, errors, and creates consistent regulatory enforcement. Has anyone underage been served here? I ask. He admits he doesn't know, but says that's irrelevant because proper systems prevent problems before they occur. I tell him to enjoy his beer. I can't enjoy it knowing you've compromised your establishment's legal standing by failing to verify my age. What if I was an undercover compliance officer? I look at him. Are you? He says no, but someone could be, and that's exactly why America has superior regulatory frameworks. He drinks the beer anyway, but leaves a lengthy Yelp review about our cavalier approach to alcohol service verification. My sister manages a bakery in Cairns, and she had an American customer argue with her about our sandwiches being cold. She explains they're made fresh. We don't heat them unless requested. He insists that in America, food safety protocols require maintaining hot foods at specific temperatures to prevent bacterial growth. And serving cold protein creates health risks. It's a chicken sandwich, been in the fridge. He starts explaining the danger zone concept. How pathogens multiply between 40 and 140 Fahrenheit. And Australia's apparent disregard for this established food science puts customers at risk. My sister mentions millions of Australians eat cold sandwiches daily without incident. That's anecdotal evidence, not systematic safety data. He wants to speak to whoever is responsible for our food safety program. My sister points out she's responsible and the sandwich is safe. He asks if she's completed food handler certification. She shows him her certificate on the wall. He photographs it and says he'll be researching Australian food safety standards to compare them with American requirements because this interaction has raised serious concerns about public health oversight. I'm a taxi driver in Darwin, and I picked up an American couple heading to their hotel 6 kilometers away. Traffic's light? I take the direct route, estimated 12 minutes. The husband immediately opens his phone's GPS and starts comparing my route to what Google suggests. You're not following the optimal path. Why are we going this way? I explain it's the quickest route at this time of day. Google shows a route that's 3 minutes faster using Bennett Street. I mentioned Bennett Street has roadwork currently. Detour adds 10 minutes. He shows me his phone, but the app doesn't indicate roadwork. I tell him I drive this route daily. Trust me. His wife asks if taxi drivers in Australia receive route optimization training like American drivers do. I say we learn the streets through experience. The husband looks at his wife. No formal training. Starts calculating whether my inefficient routing will increase the fare. Pulls out a calculator app to determine if the extra distance exceeds industry standard fare-to-distance ratios. I'm literally driving to their hotel. He asks if Australian taxi regulations include customer protection provisions for route disputes. We arrive. The fare's $18. He tips nothing and leaves a comment card about needing better GPS integration protocols. I work at a train information desk in Melbourne, and an American tourist demanded to know why our trains don't publish real-time delay statistics like American systems do. I pull up our app showing live updates. He says that's not what he means. He wants longitudinal data about on-time performance percentages, average delay durations, and primary delay causation factors. Why? I ask. Because informed consumers deserve systematic transparency about service reliability, he explains that in New York. He can access detailed performance metrics that help him make optimal transit decisions. And Australia's lack of comparable data suggests we're hiding poor performance. I mention our trains generally run fine. Generally. That's not a measurable standard. He wants to file a formal complaint about inadequate data disclosure with whatever regulatory body oversees public transportation. I give him a website for Public Transport Victoria. He asks if they publish quarterly performance reports with statistical breakdowns. I tell him to check the website. He spends 20 minutes at my desk researching Australian transport accountability frameworks on his phone, occasionally asking me questions about governance structures. His train arrives and departs while he's researching whether he should complain about the lack of data about the train he's missing. My cousin works for Queensland Parks, and she had an American visitor call asking for exact wildlife encounter probability percentages for different hiking trails. She explains, "We can't provide specific percentages because wildlife movement is unpredictable." He insists that with modern tracking technology and ecological data collection, statistical probability models should exist for tourist safety planning. "What if I told you there's an 18% chance of seeing a kangaroo?" she asks. "Is that number real?" "No, exactly. That's why I need the real numbers," she explains. "We just tell people wildlife is present. Stay alert, maintain distance." He argues this is insufficient risk communication because different tourists have different risk tolerances. And without quantifiable data, they can't make informed decisions. "People see kangaroos sometimes," she says. "Sometimes is not a statistical measure." He demands to speak to whoever manages wildlife encounter documentation. She tells him she can transfer him to a ranger. Will the ranger have the probability data? No, then what's the point? He hangs up, presumably still seeking the quantified wildlife encounter metrics that don't exist. I'm a diving instructor in Cairns, and an American student asked for the certification validity period for every piece of equipment we used. I explain, it's all regularly serviced and safe. But when does it expire? Scuba equipment has mandated inspection cycles. I tell him everything's current. Current isn't specific. In America, we'd see documentation showing exact certification dates and renewal schedules. He wants written proof that every regulator, BCD, and tank meets current safety standards. I show him our service logs. He starts reading through them looking for gaps. He's asking why one regulator was serviced 3 weeks later than another, whether that represents inconsistent safety protocols. They get serviced when needed, I explain. But how do you determine need without standardized intervals? He pulls out his phone to show me American diving certification requirements, explaining their superior systematic approach ensures consistent equipment reliability. I'm literally wearing the gear he's questioning. "This equipment's working fine," he asks. If Australia's more casual approach to equipment certification might explain our higher diving incident rates. I tell him our rates are extremely low. Compared to what baseline? We're at the boat, time to dive? He spends the entire briefing asking about backup equipment certification status instead of learning hand signals. I'm a hotel concierge in Sydney. And last week, an American guest asked me to rank all the local beaches by objective safety metrics. I start listing beaches. He interrupts. Not names, metrics, lifeguard response times, historical incident rates, water quality measurements, UV exposure indices. I mentioned Bondi has lifeguards and good facilities. That's qualitative, not quantitative. He wants a spreadsheet comparing 10 variables across 15 beaches so he can make a data-driven beach selection. I tell him they're all fine. Pick one that's close. He looks genuinely pained. How do Australians make decisions without proper data? I suggest we just go to the beach that looks nice. He asks if I understand how risk assessment works. I'm standing in a country where people swim in the ocean. It's wearing minimal sun protection while drinking beer at 10 in the morning. Mate, I tell him. She'll be right. He looks at me like I've suggested jumping into a volcano. 3 hours later, he's still in his room, building a beach comparison matrix in Excel. The American capacity to transform peace into panic is genuinely remarkable. We'll be standing in a perfectly calm situation, sun shining, birds chirping, everything functioning normally, and an American will manifest a crisis through sheer analytical determination. They don't need actual danger. They'll extrapolate potential danger from the absence of warning labels. Australian culture runs on the assumption that adults can generally figure things out without 17-step protocols. American culture apparently runs on the assumption that without constant vigilance and systematic documentation, civilization will collapse by Tuesday. both countries survive somehow.